All right. Good afternoon, everyone, and thank you very much for joining us again on our Friday webinar series. I appreciate what every single one of you have been doing out there over the course of the last many weeks to keep our community safe and keep your businesses open and operating to the extent to which you've been allowed to. This has been such a difficult time on so many levels, on the human level, through the public health crisis, and on an emotional level. The fear and anxiety is high, and certainly we see just today more information on the sort of staggering economic toll this has taken, not just on Central New York, but on our country. We're really happy today to be joined by County Executive McMahon. Ryan, thanks for spending some time with us again. Appreciate tremendously the work that you've been doing to lead this community. And I just want to start off by saying, this has to be one of the most difficult things that any of us have been asked to navigate and work through. Emotions are running high, as we know, on all sides of the debate and discussion. And I've been really proud, generally speaking, for how Central New York has pulled together. Even when we have different perspectives, we sort of pulled together to do the right thing. Everyone wants to get the economy moving again. We want to do it right, and appreciate the leadership that you've been showing in helping us get there. After we hear from the county executive, we are going to spend a little bit of time, about 10-15 minutes. I think we've told you we've been preparing a reopening toolkit, just some guidance and advice and some resources that we want to make available to the business community and our not-for-profit community in Central New York as you start to think about your own business reopening strategy and plan. So we want to share with you what we've been doing on your behalf. And after that, hopefully we'll have about 25 minutes for moderated Q&A. I just remind folks, please submit your questions in the chat, and we will moderate them and get to them as soon as both we hear from the county executive and from Manager Fish. So with that, I will turn it over to the county executive, Ryan McMahon.
And thanks, Rob. I appreciate giving the opportunity to be here. Thank you to everybody who's tuning in. Certainly, we're at a new phase of this process, really, as we prepare for restart. Certainly, we believe we're going to be the first region, if not, others joining us on May 15th/16th, whatever the technicality is there. But we've started to see kind of a slow phase into this restart, loosening of regulations on businesses right now that are operating. But I'll go over what drives the when, what we need to do as a community. Because that's quite a bit of work right now that we're undertaking. And then certainly talk about what our plan kind of entailed, the comprehensive approach for our plan. The state has given out some direction on what they'll do with the phases. Much of that was very similar to what we were talking about. There are some areas certainly with what the state has given that they have not been specific. We believe that's probably intentional, which is good, we believe, for our region. So just some key metrics that have to be hit. And our region right now has hit essentially 6 of the 7 that need to be hit. In the 7th, we certainly will hit. But right now, when you look at the ability to have a certain number of contact tracers, contact tracing is something we do right now when we get a positive case. Our health department's going to contact an individual who's tested positive for COVID-19. Part of that is the immediately checking in on their health and certainly making sure that they are getting the help they need if they don't have a support infrastructure to help them get food. During the process, they'll be in an isolation. But immediately we go into looking at essentially from 2 days before they had symptoms of COVID-19, and then looking at what all their daily routine was, where they were, who they contacted, what level of contact did they have. And then we begin to go contact those individuals. And essentially those individuals are put into a quarantine for 14 days. And that's what, when you hear contact tracers, that's what's going on. We've been doing this already. For the most part, your local health departments have been doing this throughout the state. Some not as much as others, which is quite remarkable. But we now have numbers behind what the state wants to see happen. So in our county, it's about 140 contact tracers. In our region being Cortland County, Cayuga County, Madison County, and Oswego County, we need about 230 contact tracers to qualify for restart. So what we've done is in county government, we have these tracers, they do in the health department that have been doing this work, but we also have contact tracers in other departments. Think about children protective, family. We're tracing and doing investigations to prevent child abuse. When you think about our probation department, we're doing tracing there. We're doing tracing in our adult and long-term care department, as well as district attorneys, sheriffs. So what we've done is we've identified 300 county employees that are going to be cross-trained in this curriculum that is being put forward by Johns Hopkins University. Johns Hopkins University actually is Dr. Gupta's alma mater. So she has great contacts there to begin with. So we're going to be doing that, implementing that. So with Onondaga County alone, we will have enough contact tracers to meet the goal for the whole region. And we're talking to other counties about having our contact tracers potentially be a shared service for them. And they would still have a team leader from their health departments, but some of our tracers would then flow into to there. So we could have people helping Cayuga County, Madison, Cortland, et cetera. But that's one of the items that some communities are struggling with. We got it under control. The other obviously is hospitalization capacity. Again, we're in great shape. The metrics on this though are a little troubling because our really what we're being graded off of is our worst day that we had through this process, and essentially how many new cases you're allowed per 100,000. And we never had a really bad day. So our numbers are artificially low. So hopefully we'll get some common sense will prevail as this process goes through, because specifically in our community, our cases right now, this virus has infected our nursing homes and our most vulnerable. And these are people who were having severe medical issues to begin with. So that could drive hospitalizations up as this process goes. But certainly we meet that standard today. We hope that there's some common sense being used in this as this process moves forward, because we know that any community that gets an outbreak in nursing homes could see their hospitalization rates go above this metric, which that metric makes sense for the communities that were hit very, very hard and really saw a spike in hospitalization rates. We were very effective at flattening our curve early and preserving that medical infrastructure. So our worst day was never even a stressful day for our hospitals. So that's a little bit of a challenge. We're watching it closely. You've probably heard me over the last few days we're working with our nursing homes specifically now to our county, because some of them, believe it or not, have the right, if they get a patient, they can drop them off at the hospitals. So some of them who didn't have COVID units, if they got a patient, even if it was asymptomatic or light symptoms, they were dropping these individuals off at the hospital. And that's something we can't have. So we've actually got the nursing homes all working together, and we will be moving COVID patients from facilities that don't have COVID units to facilities that do. And the county will be taking the lead on that to make sure our hospitalization rates don't artificially jump for folks that don't, we need the beds for folks that are that sick. In addition to that, the one metric that we haven't really hit because the rules have changed mid-process is testing. The rules throughout this process have been, if you have any of the symptoms of COVID-19, you get screened by your doctor, then you get a test. And so we in our county have really essentially the lowest infection rate in the state when you look at our population. So we haven't had a lot of sick people, and that's good. But when you're putting these new testing mandates on, essentially 30 tests per every 1,000 people per month, that represents a real challenge, because we won't be able to hit these with sick people moving forward. So we started proactive testing in the county 3 weeks ago. We were proactively going into assisted living facilities and independent living facilities where there were COVID cases, really looking and searching out for the virus in asymptomatic individuals. And we found it, and we've done that, and we've done over 1,600 proactive tests. The state, at our urging, is now testing all individuals and residents in nursing homes. and we now have nursing home employees going out and getting tested. Some facilities we've provided testing, they're doing it themselves. Others have been going to various testing sites. So now we're kind of doing this proactive testing, hunting down the virus, and that's what we're going to have to do a lot of moving forward, probably 10,000 tests a month of proactive testing. So we'll start out in areas of density. We'll start out looking at where we're finding cases, if there's trends, or maybe there could be trends. We're going to go with mobile testing into labs, but we need a 7-day average of about 775 tests as a region to trigger our restart. So they've changed the rules. It's okay. We already kind of moved into this phase anyways. We'll hit our 775 average a day. This is something we actually control. So we're going to be doing a lot of testing over the next week here, as we have been over the last week. So we'll hit that metric. So when you hit all 7 metrics, what does phase 1 look like? There's widespread agreement that phase 1 will be loosening of construction. All construction will be green light go. All manufacturing will be green light go. There will be a loosening of retail. The governor's used the phrase curbside pickup. We believe that's probably more appointment type only for certain retail that's been on the sidelines. Recently, our auto dealers had, interpretation guidance that we gave them in partnership with the state that allowed them to open up their showrooms by appointment only. So we think that's kind of where that's going. If you think about elective surgeries for the hospitals right now, affiliations with the hospitals are a green light go, but some of these surgery centers have yet to get going that don't have these affiliations. So we've been pushing the state to allow that as well. So maybe that is a little bit of a regulation loosening going into restart, or it will be part of restart. So restart phase 1, we hope to get more specific moving forward, but essentially think about businesses that Empire State Development has deemed essential. They have regulations, some of those regulations loosening, and then in some categories that are deemed non-essential today, maybe we can get some of those in phase 1, but with regulations. So that's really what we're looking at. Then the key being, we're doing our robust testing, our contact tracing in real time. We're looking for emerging trends, making sure our hospitalization rates don't spike up in this period of time. New cases don't spike up in this period of time. Everything goes well for 10, 14 days. And then we go into phase 2. And phase 2 is really where we'll challenge the virus. You'll think about your downtowns coming back to life, your offices coming back, some regulations on retail loosening up, and other phase 1 regulations maybe coming off. And then that's when we really get to test the infrastructure we've built up to track the virus and fight it in real time. And then if things go well, then certainly we'll be prepared for phase 3, which then is more about your businesses that deal with gatherings of people. And that will probably be in a controlled setting before a phase 4, which then basically loosens up the economy, and we're back to where we were. So there's still a lot of meat to be put on the bone, even for phase 1. We're having many, many discussions and many calls. Certainly, we believe locally that giving us the ability in our region to have more input on this, because it is our health department's ability to fight the virus in real time that's driving this. So we believe we have a little bit better of a grip on what we can and cannot do than, for example, the state health department, who's really a regulatory agency over our folks. So that's kind of where it is, where it looks at just everybody just needs to understand we're not going to get to a point, at least in the immediate future, where we don't have cases. The community spread cases have been stabilized. Certainly the period of time after our voluntary shelter in place, if you look at the 2-day lag time after that, when we started that is when we had our lowest number of community spread cases. On average, our 7-day average was 11 a day, which was really, really good. We loosened that up. That's moved up to 19 a day. Certainly, there's a direct correlation of good weather days, 5 days, 7 days later, your community spread cases go up. For you business owners, and we really need you to take this very seriously with the proper protocols. And I want to thank Rob and CenterState with the toolkit to help you with that. Because the reality is this will continue to be very disruptive to your business with key employees. If someone tests positive, the soonest you can have them back is 7 days if they get better right away. And if you get somebody who's in a social setting that they shouldn't be, they have to go into a quarantine. That's a minimum of 14 days. If they then get themselves, they're in a quarantine for 10 or 11 days, and then they have a situation where they show some symptoms, then they're going to be in 7 days after that. So this is still a real threat to the public and certainly to your business. You don't want your key employees putting themselves in situations that aren't smart. And certainly, anybody can test negative one day and the next day get this thing. Certainly using masks, sanitizing both, the facilities, but also constantly washing your hands. I sanitize my hands probably every 20 minutes these days. And then, obviously the proper PPP, proper physical distancing in your facility. These are all things that will help prepare you for success, but also just when your employees are outside of your work environment, it's much easier to regulate your work environments than what they do outside of that. That's going to be critical to the near-term success of your business and our community at large.
Great. So that was a really good overview. I think just before we move on and start talking about the toolkit, just one question that has come through. You mentioned the need for contact tracers and certain testing. Does it look like at this point we're going to be on track for the May 15th date to hit those goals that the governor's articulated?
Yeah, we've hit the contact tracing number already for the whole region. So my brothers and sisters in Cortland, Cayuga, Madison, and Oswego, we got us started by ourselves there. The testing, we would have liked to ramped down our testing related to proactive testing the week in advance of May 15th to really help focus in on getting recoveries out of our active caseload and to really have a good sense on where the true community spread is as a benchmark when you give more density to the public. But our understanding is that we need to hit this massive number of testing on a 7-day average to basically be able to restart. So we won't be able to slow down. We will speed up to hit that mark so we can get our economy going. And then that will just, create a little bit more workload. Maybe instead of needing 40 out of our 300 tracers in the beginning, we'll need 80 to really get through the workload that we're creating. Because the reality is as follows, and this is what people shouldn't freak out when we talk about positive cases. The data shows this, that 8% of the folks that we test are going to be COVID-19 positive. And when that percentage gets skewed higher, it's related to nursing home testing where the virus is already in these buildings. At some point, we'll be doing so much proactive testing that that number will get lower. But for every 1,000 people, we're going to have 80 positive cases. Some of these will be asymptomatic, but that's the reality. So if you're asking us to do 14,000 a month, 8% of 14,000, do the math. We're going to have a lot of new cases just because we're testing people that, some of them will be sick and symptomatic, some of them won't. They will have had mild exposure to this and never got sick. So that's the reality of this, is that this virus will be with us unless it behaves like SARS and it leaves and then it comes back in the fall.
So I think, it's a great segue into, a discussion about some of the tools that we can make available to our business community as you start to think about reopen. I do just want to emphasize, though, for those who don't get to see or experience it on on a daily basis. And one of the reasons why we Central New York, I think, are in a position that we are is twofold. One, which is the county exec and the county health department done a phenomenal job managing the public health side of this crisis. But two, our communities really pulled together, our governmental leaders, our business leaders, to work together to advocate for our state to recognize that we are different than downstate. That collaboration has really allowed us to have this conversation with you today about how we can help get as many people back to work as possible and try to start making a dent in that, really unfortunate 14.7% unemployment rate that we all heard was announced today. So we're going to segue real quick. I know we got a number of questions that are coming into the chat, but I want to hold those until we get through a quick presentation on the toolkit. So I'm going to turn the program over to our Senior Vice President for Business Development at CenterState CEO, Andrew Fish.
All right, good afternoon. Thanks, Rob, and thanks, everybody. Excited to walk through this with you. As we were hearing about the need for businesses to be reopening and the prospect of kind of a phase one starting, we realized that there was a lot of information out there and wanted to try and find a way to synthesize as much of it as we could and create a resource for businesses to access. And so we're going to walk through at a very high level today what's in this toolkit. It's going live on our website today. In fact, I think as we speak, it's now live, and we'll point you to that at the end of this webinar. But the reality of it is that it's not going to be as simple as just stating once the May 15 date happens for phase one or subsequent phases and subsequent dates saying we're ready to reopen and just opening your doors and letting people come back in. There's a lot of things that are going to need to be done, a lot of protocols and things to consider as a business. And so we wanted to share some of those with you. And what I'll also say as it relates to this toolkit is, we're putting this out there as guidance and, opportunity for you to look at this as information and planning purposes. But we really encourage you, and we link you through this toolkit to sites like the CDC, the Governor's New York Forward reopening guidelines, Onondaga County and their protocols, and local municipalities to really look at what is being expected of you at the federal, state, and local level. So Ben, go to the next slide. We've got three. This is the phases that were already spoken about, and the one thing I will say is that the time in between these is subject to kind of the data and what it's being said there. And what we're seeing from that. I know there's probably a lot of questions that people have as it relates to whether or not your business falls within one of these categories. And additional guidance will be forthcoming as it relates to each of these things. But if you do have a question, I would encourage you to reach out to the email that we set up, support@CenterStateCEO.com, and we can walk you through kind of maybe some questions or thinking about where you might fall in some of these categories. But, I think we're going to be expecting a minimum of a couple of weeks between each of these phases, possibly longer between some of the later phases, depending upon what we're seeing. But it's encouraging to think that we're going to get started in phase one here. So the toolkit has three main sections, and there's key components to it. And again, these are all just each business is going to have a different set of things that you're going to need to think about and plan for. So the toolkit is designed to really give you some high-level thoughts around questions to be asking yourself, resources to be researching, and places to look for additional guidance. So the three main components that we want you to consider is, what do you need to be doing before you even open your doors? What are your pre-opening considerations? And we'll walk through some of those. What are your operational considerations once you're back in business, and how you're interacting with your customers and your staff and your protocols? And then what are some of the strategic considerations that you should be taking into account right now, both leading up to and following a reopen? So we'll dive into a little bit of the pre-opening considerations here next on the next slide. And workplace safety. This is something where you're going to have to think about, do you need to sanitize your facility before people come back in? What are some of the fears that your customers or your employees might have, and how you need to address those? And what you want to do in terms of communicating safety as a top priority. One of the recommendations that's out there and that we have listed underneath this on the toolkit is the opportunity to identify an employee who is your COVID workplace coordinator. And also, you would really want to consider what your needs are around personal protective equipment, PPE, and training and how to use that. Worker recall procedures. How are you going to phase your workers coming back, returning? How ongoing shift changes may be impacted, and also questions around what you would need to do if you have employees who are unwilling or unable to return to work for various reasons. Employee benefits, obviously, whether you've gone through furloughs or layoffs, there's going to be different notices or different actions that you may need to take. So think through your retirement plans, your health insurance, and you know how that is impacted differently, whether they were laid off or are in furlough. And you know, again, there's additional guidance to each of these on our website that we'd ask you to take a look at. Employee compensation. This is another one where, you know, you may have been in a situation where if you had some sort of essential operations going on and you're reopening other portions, you may have instituted some sort of hazard pay, or you may need to institute some sort of hazard pay during your early phases of reopening. And how do you handle that? And how do you handle that in a you know, return to work environment across the board? So the next slide is still more pre-opening considerations, but the remote work piece is one, before we go on to that I really encourage folks to think about. If you've had remote work taking place in this environment, think about the opportunities that exist for you with continuing portions of that on a go-forward basis. You may find that you have higher levels of productivity with some of that instituted. And you may be able to find ways to incorporate that into your ongoing operations. So the last 4 items here on pre-opening considerations on the next slide is internal and external communications. Make sure that you are really understanding how you're messaging your reopening, how you're putting information out there to your employees and helping them understand what your plans are and how you're going to reestablish your processes and procedures. Also recommended there is an idea around media communications. You know, what if you get reached out to by the media as it relates to your experiences during that reopening? How will you handle that? New hire paperwork. Again, this is something to just take into consideration when you think about new employees or bringing people back from furlough beyond what you've done previously. Policy changes are kind of encompassing a lot of this stuff. So if you're thinking about remote work now becoming a part of that, if you're thinking about the new compensation that you're needing to deal with, or if you're thinking about flexible schedules or dealing with employees who are unable or unwilling to return to work, all of these things you need to really think about from the broad policy perspective in order to really make sure that you're instituting these changes across the board in a way that will set you and your employees up for success. And then union employees, this is obviously relevant for those that have a labor agreement in place, and you should really review that and consider the potential impacts of any layoffs or furloughs that you've done, and review your rehire or ensure that whatever your reopening plan is in line with that agreement. And if not, consider reaching out to union leadership and proactively working with them to amend that or to renegotiate a reopening plan. So really moving into operational considerations, once your doors are open, you have your physical space that you need to be thinking about. Do you need to change the layout? And this is somewhat of a pre-opening consideration, but it's really in light of what will happen during your operational, once you are operational. And so do you need to, change the seating of your employees and create greater distance? Do you need to change the way in which your employees are moving through or the customers are moving through your place of business? All of these things are what you need to look at. And your industry specifically may have particular best practices around this. And so as those resources become available, we'll be pushing those out through the toolkit as well for you to identify. Staff protocols, this is a number of different things here as it relates to potentially cross-training folks to cover additional operational needs. Simply because you may, again, in the environment that the county executive was talking about, if someone identifies as symptomatic or tests positive, you have a period of time where they're going to be out of work. And how do you make sure you're covering for that as it relates to the operations or the productivity that you're trying to achieve? Cleaning protocols, there's a lot of guidance out there from the CDC and OSHA as it relates to best practices, and some of that is specific to your industry. So review this and think about how you institute that and change that in your schedule. Employee compensation, we talked about that in the previous one. Actually, I think that one is that's in the pre-operational considerations. But customer interactions, again, think about things that you might be able to do in terms of encouraging cashless and touchless options for your point of sale systems. Or, do you need to set up things like physical barriers between cashiers and customers? So what are some of the opportunities you have to think about creating higher levels of safety for yourself, your employees, and your customers? And then finally, we really think it's a great opportunity to think about some strategic considerations, which is on the next slide here. And so, obviously this has caught a lot of us by surprise. None of us were really anticipating this. And so while, I consider even us as an organization at CenterState CEO and our emergency plans and our protocols that we had in place and business continuity plans, and it certainly didn't take into consideration a pandemic, at least in this regard. And so it's a great opportunity to really document the lessons that you've learned and the new policies that you're instituting and the considerations that are top of mind for you right now, to be able to incorporate those in your continuity plans on a go-forward basis. Assess your essential functions. Think about if for whatever reason we have another spike in the future and there's a need to go back into another form of a shutdown or a reduced operations, make sure you really are understanding what essential functions you have as an organization and how you can continue to maintain those. Timing of reopening is important as well, because you want to really think about the timing in a way that's strategic for you, right? And so give yourself enough time if you have to retrain employees or you have to institute those new protocols or training on the PPE that needs to be instituted as a part of the new process so that you're ready to serve the customer once those doors finally open. And then also think about maybe the most strategic time frame for you as it relates to getting the most customers through your door. Capital resource planning is extremely important, making sure that you've got the runway as it relates to cash management, as it relates to any needs that you have from a capital investment standpoint. And we encourage you, if you haven't already, I'm sure many of you have, but start having conversations right away with your financial institution or your financial advisors to be talking through some of those critical issues. And then ongoing communications, how do you address employee concerns on a go-forward basis? How do you deal with external rapid response measures? And do you need to think about something as simple as new physical signage? Wayfinding within your establishment now to guide customers. You used to have two doors, now one of them's an in, one of them's an out, whatever that looks like. Think about those implications. And so, the one thing I'll say, and you can go to the next slide, Ben, is that the toolkit itself, each of these areas, it's very information heavy, but we're trying to present it in a way that is easy for you to work through and at least ask yourself the question. And sometimes you might get to the point where you look at a question and say, this isn't relevant to me. Or other times you might say, I really need additional information. So we've tried to link resources where appropriate or where available. And the other thing I would say, if you as an organization have thought through some of these things, and have really identified some best practices or some protocols that you have in place, we want to hear from you on that. And hopefully you're willing to share that as well, and we'll end up linking it into the toolkit. The final piece that we're presenting with this toolkit for your use is something that's just kind of an easy way to keep this stuff organized. And so Ben, if you want to go to the next slide, we created kind of a checklist for you. It's a one-page document that you can download from the website and just kind of go through, take your notes on it. As you've gone through and asked yourself those questions, you can check them off. You can, indicate that they're not applicable for you or whatever that is. So when you get down to the end of this, you can feel confident that you've asked yourself all these questions and you have a plan in place that will meet your needs as it relates to reopening. And I think that's the bulk of what we wanted to talk through the toolkit with you. Again, the website is up. The document there that you saw at the end, the one-page checklist, is available. If you have questions as it relates to your particular business, the support@centerstateceo.com email is available for you to reach out. And certainly, as I had said before, we're really interested in hearing from you if you have what you feel is a good best practice that you're instituting and how we can share that with the rest of the regional economy here. So I think we got some questions that we're looking to answer, so I'll kick it back to Rob to kind of facilitate that, but we're really happy to have everyone participating today and hope this is a resource that you find very valuable.
Great, Andrew. Thank you to you, but also to the entire CenterState team. We've literally been working nonstop for 8 weeks, fielding thousands of calls and emails from businesses. None of us have had to navigate this before. We've never had to build a reopening checklist or a restart plan. And so, we are building this from scratch. Inevitably, we get inbound from all of you on a daily basis with ideas and things that we could add to this toolkit. That's really helpful to us. So, share your suggestions. And just to let you know, next Friday, for our Friday webinar series, we are going to be bringing you what we're calling lessons from the front lines. We're going to be having a presentation from 3 businesses who were deemed essential early on in this process, who've been operating for the last 8 weeks. And we're going to have some of the operational folks for those businesses share their experiences, what they've done to keep their employees safe, and provide you with some direct firsthand advice about what you can do to get ready with your own plan. One of the questions that has popped up here quite a bit is around, there's all this discussion about plans. So, when you listen to the governor's press conference, he says every business is going to need a plan. And so we're getting the question all the time, well, is it a written plan? If so, what's the template look like? How long is it supposed to be? Where do I submit my plan when I'm done? I don't know, Ryan, if you have any thoughts or advice on that at this point.
Yeah, I think overall, we've been receiving a lot of different business plans. Some businesses are taking this to be send a business plan. Really, I think what's being referenced is kind of industry specific and where that fits. And so certainly there's various industry trade groups that are working with the state, working with us on this. We're looking, again, I think Andrew put up on one of the slides here, what the kind of the broad phased in restarts look like. And there'll be a lot of specifics that need to flush itself out. There are many different businesses that don't perfectly fit into those categories. So our suggestion it has been to everybody in your own business, especially if you're sitting on the sidelines and you're waiting to get back in the game here, is to send us some ideas, how you can safely open really with what we know to be the new norms with physical distancing and protective equipment for your employees and customers. But don't think of it through Central New York. Think of it through New York City, Long Island, the Hudson Valley, Western New York as well, because what we do here has to fit for the whole state. And so that's what we've been suggesting. We've been getting a lot of very good feedback from really a lot of the industries. And certainly we know people are hungry to get back to work. They're hungry to try to salvage what they can for the year, get their employees going, and start to get this economy moving again.
Yeah, and I think we've definitely, I think, very, very similar advice that I would share, which is while we are in this lull, especially if you haven't been open, you're waiting to get back, whether you're a phase 1 business or phase 2 or phase 3, especially for folks who are phase 2, phase 3, phase 4, you do have time still to put this plan together. And whether or not it ultimately ever gets submitted to the state or to any entity, this is my personal feeling. I don't think that there's going to be anyone sitting down there and reviewing the reopening plan for every single business in the state. There's not enough people. There's not enough bureaucracy to go through that. I don't think it'd be a very productive use of the time. So I personally think this is a moment where each and every one of us as business leaders has to take some ownership and make this a part of our best practice and make a commitment to ourselves and to our employees that we're going to take the time to do this reopening plan right. We're going to take the time to keep people safe. And then, ultimately we're going to be accountable to ourselves. We're certainly going to have to follow the guidance and the laws and the executive orders that are out there. And I think the governor and the county exec will make those things clear when and where they can. But beyond that, I think this really is an opportunity for us to lead by example. And I think what the county executive said is absolutely correct. All eyes across New York State and frankly, in some parts of the country are on what's happening here in Central New York. And I know that I feel strongly I want to be a part of getting that right. So I'm just looking through the chat here.
Just a quick reminder, Rob, sorry, that, again, if you do have questions on the, where you might fall in terms of a business, that guidance is going to continue to come out, but feel free to reach out to the support at CenterStateCEO.com to, ask us a question. We're happy to talk through that with you and at least provide whatever interpretation we can, understanding that the official guidance from the state is going to be the most important piece on that.
Yeah, and just to be clear, at this point, there is no place for you to submit your plan to the state. There isn't a mechanism that's set up for that. I really suspect that it probably won't be. But certainly, if the governor or the state decides that that's something they want to do, I think they will let us all know. So I just want to emphasize at this point, there isn't necessarily, Ryan, unless you tell me I'm wrong, there isn't a place where you are being directed to submit this plan. It's more a strong recommendation that each and every business take these questions seriously and get ready for reopen. Is that right?
Yeah, that's right. And one of the things we are doing, though, our impression the whole time has been, if you can operate your business in a safe way and it makes common sense, and you might be on the sidelines or you have restrictions, we've been taking your feedback and going to ESD and the governor's office, looking to loosen things up. And loosening up regulations before restart has value for us. From a public health standpoint, because we get a little bit more density and we get to kind of see how that reacts with the virus. So, we've gotten a lot of plans. We reviewed them all that have been sent to us. Certainly, I agree with Rob. The state doesn't have the manpower to review every plan, and they're going to approve every business. I think we'll see more specific guidance. And where the state does not give specific guidance on some of the things, they may lean on us to give guidance and interpretation on what may qualify for phase 1 or phase 2. So if that happens, we feel pretty good about that.
Yeah, and I just want to emphasize for folks, if you're starting to think about this, if you don't have a plan already, it's okay. The good news is between the county, between us, there are a lot of templates out there. We're giving you some key questions to prompt your thinking through this toolkit and links to resources. But we've also had a number of businesses that have been open who've agreed to share their templates or their plans with us and allow us to share them with you. So, if you're struggling with where to start, feel free to reach out at support@CenterStateCEO.com, and we'll do our best to empower you with at least a rough outline so that you can begin working through it and doing what needs to be done. So Ryan, one of the questions that we seem to be getting a lot of is around the timing of the phases. So can you just remind people both, this generally, when things are likely to start, what the time between those phases is likely, and how that timeline could change based on the public health response?
Yeah, so it's really going to be a 14-day period. And why 14 days is because the virus typically it can incubate from 5 to 7 days. And so if you think about it, restart happens on a Monday. We won't know what happened on that Monday really until Friday at the earliest, as far as public health goes. Then through the weekend, we need to be able to get enough data to see what kind of movement we've had in caseloads. And we'll start to see that really 7 days. And then we need to see if we have a trend. So that's why the 2-week period. Things go well in phase 1 to phase 2. We probably anticipate that that's going to happen. We'll get some more cases in the community spread category. Again, the 3 categories of cases are affiliations, which right now all of our data is being driven by senior affiliated property, mainly nursing homes. Then your contacts, your household contacts, we already bake into everything the fact that if you're positive and you have a spouse or a significant other living with you and others in the household, that there's a higher percentage that those individuals will get COVID. Those folks are already in a quarantine, so the risk to the public is minimized. So those are different than the way we look at community spread. Community spread is the randomness of the virus and how fast it's infecting others. So right now we're in a good spot. It's not our best week, but it's certainly very stable where we are right now going into this. So phase 1 to phase 2, we don't anticipate any issues. Where it may be a challenge, and what we don't know is phase 2 to phase 3.
Great, thank you. I think there's been some suggestions I know from folks on the line about partnerships. I think it's a very valid point to emphasize. There are a number of businesses that have been open throughout this. I see many of you familiar faces on the line, and so The good news is there are people we can pair you up with if you're thinking about wanting to talk to someone with real world experience who's been operating in essential fashion. Again, reach out to us at support@CenterStateCEO.com, and we can try to pair you up with a business that's gone through this and has some real world experience. It's also part of our thought process around our seminar next Friday is to bring that real world experience to you live and get some firsthand examples of things that people are going to do. Ryan, one question that just came in is around municipalities and how what the role for towns and villages is in this sort of reopening process, or how the reopening phases might impact them and their work. I don't know if you want to speak to that.
Yeah, many of the towns and villages have declared a state of emergency, which gives them the ability to loosen up some of the guidelines they had on limiting. If you think about it, we were under the same guidelines of limiting the number of employees you have in our operations, just like you all were for those who remained open. So if you have a town or village government, those governments don't really have a lot of employees outside of the specific services they provide. So really this shouldn't impact them as much. Phase 2 essentially brings back your back offices and certainly the larger offices. Think of your downtowns coming back to life essentially. So that's really where we would recommend that those municipalities start to reintroduce their workforce to the buildings. And one of the things we all have to consider is one of the things in the toolkit was consider remote, your employees working remotely if they can. That's something we're going to consider in county government specifically, and I would ask you all to think about this, employees who have underlying medical conditions. There are high levels of anxiety in my email inbox for folks worried about that with restart. So one way to be able to address that with your employees is, can those employees that you have documented that they can document they have underlying medical conditions, can they work from home still? That's something in county government that we're considering.
Yeah, I think it's also important to note that, one of the things I've heard the governor say over and over again, I think I've heard you say it as well, which is even when we reach these phase milestones and a business is allowed to reopen, there's still a recommendation for social distancing. There's still a recommendation in place that if people can work remotely and without impacting, the business significantly, that's certainly a desirable thing to continue to encourage to the extent to which it's possible. And so I think that's important for us to recognize that, the difference between being allowed to reopen and what is safe and prudent in terms of how we reopen. And I think that's part of this discussion today, is really to try to get all of you, I know you're already all thinking about it, but to try to give you some tools and resources to think through that in greater detail. For any other questions, and feel free to send them into the chat. Ryan, I guess while we wait to see if anyone else has questions or looking for answers on, I guess I would just be curious from you. Obviously, you've had to sort of be sitting in the captain's chair for this throughout the course of the last 8 weeks, and fielding the inbound on all sides of the debate around reopening and around people's fears and anxieties. Do you want to offer any reflections, just given the fact that you're probably hearing from every single person in the county about their personal and professional opinions?
Yeah, we feel what's interesting is we can feel the shift of the emotion and the mental health behind this crisis, and tell you where it's going based off of our communication that we're getting. Certainly the community was paralyzed in fear in the beginning of this process. And really we're at a point now where the economic reality, the economic ruin, the distancing from each other is really taking a toll on everybody. And the mental health aspect of public health is certainly factoring into all the decisions that we're making. Public health is more than COVID-19. We're really tracking and preparing for challenges related to suicide rates, opioid addictions. Opioid deaths went up last year anyways. So this is something that we're concerned about moving forward with addiction based off of what has happened to us. And so the key to how we've taken and approached this has always been get as much good information and data that you can, so you can make informed decisions and let that drive your decision-making process, and be open about everything you see and transparent about everything, and be willing to pivot as it becomes necessary. And so really what I think why we've had success is, we're all working together. We recognize we're all on the same team. There's been very little pride in authorship, which often doesn't really allow good teamwork. And for the most part, I've been very happy with the lack of partisanship related to your local government, to your state, to your federal governments, and the ability of people realizing that there's one common enemy. It's a virus that we can't see, and it's been as disruptive as anything we've seen in the last 100 years to our communities. So I think for us to get back to where we were, which was the fact that everybody on this line was screaming at us about talent and not being able to produce talent, now you're going to have some immediate opportunities to have really a lot of talent at your disposal if you're hiring. But for us to get back there, I think we can. It's going to take time. But the way you get back there is you have to work together. And at the governmental level, you got to keep pride in authorship on the sidelines and partisanship on the sidelines.
Yeah, I just, to emphasize that point, I think I've said this a number of times in different forums over the last 8 weeks, but I think one of the things that sort of got us to a place where we were, 8 weeks ago, experiencing the highest level of economic prosperity our community's seen in 40 years was a level of teamwork that I haven't seen in my time in Syracuse. And really, people pulling together, working together, supporting each other. And I think it's those same skill sets and tools that are going to help us pull out of this in as expeditious a way as we can. I think you're right. It is going to take time. This is not going to be a quick recovery, but we've got each other to depend on, and that's worked really well for us in the past. I think it's going to serve us well in the future. I realize we're coming up against our time. One other question that's come in that I know is top of mind for everyone is, where can I go to get the necessary PPE, the masks, the gloves, the hand sanitizer that I'm going to need in my business? And this is one of the resources that we're working to link you to via the toolkit. So if you check out the toolkit online on our website at CenterStateCEO.com, we do have links to resources, and I want to thank the county executive and the county purchasing department, because they've been very helpful to us in sharing some of their sources where they've been able to find supplies to support the medical and health community. And so we are going to have some places that we can direct you to in the immediate term. Those tools and resources are up online right now. And and if for any reason you find that those resources dry up and they're not available, please feel free to reach back to us, and we'll work to get you solutions for you and your businesses as soon as we can. County Exec, any final words you'd like to share?
Yeah, look, this has been a process. We're kind of entering in this new phase, and we still have some things to learn. But certainly, you're all going to be key to this next process when we get through restart and then economic recovery. Certainly, we're open for suggestions and recommendations on from a policy side as we get going. What kind of policy do you see that will help your business get your employees rehired, retain employees, and then hopefully in the future look to grow your workforce? So we're all ears, and please feel free to reach out to us. And again, thank you, CenterState, for this toolkit. The toolkit was critical in our plan that we've been working with the governor's office on, and has really been a great resource for the state and us in Central and the Mohawk Valley.
Fantastic. Well, you can't see the chat, but I can, and there are a lot of really positive comments. I'm sure you get your share of negative comments throughout the day and the night, so I'll share with you a lot of positive comments about the leadership you and the mayor and others here locally have provided. On behalf of all of us, thanks for doing what you're doing to keep us safe and our community going. And a couple of links up there on the screen for the resource toolkit, and obviously, if there's anything that we can do, you have specific questions, you know where to find us at support@CenterStateCEO.com. We'll end there and sign off for the day. Thanks, County Executive.
Thanks. Good seeing you, everybody.